Hi, my name is Sherelle Harris. My presentation on my disease process for my class for Patho is going to be about CHF. So, CHF, what is CHF? CHF is chronic heart failure. So, when we first think of failure, we think, oh my God, there's nothing we can do for it. So, I kind of wish it would be renamed to something else like chronic heart condition and not failure because it's not a failure. Um, with treatment, with exercise and treatment, a person can be and can live a healthy life. So, what is CHF? So, CHF is when the heart does not pump effectively. It does not pump the blood needed to go and be and routed to the rest of the body and the organs. Okay, so we have the blood that it returns to the heart from the body and then to the lungs. And also, we have signs and symptoms of chronic heart failure. So, signs and symptoms would be SOB, which is shortness of breath. We also have edema, and that's mainly in the lower extremities. We have rapid heartbeat, weakness, fatigue. Also, you may have some swelling in your abdominal area. You also may have nausea and vomiting, difficulty concentrating and decreasing alertness. Now, the difficulty concentrating and decreased alertness, you're thinking, how can that be a symptom? So, once again, we spoke of the blood. The blood is not able to effectively be pumped to the other parts of the body. And one part is the brain. So, that's why it will cause a decrease in concentration and alertness. And one thing to be conscious of is the shortness of breath. Okay, walking 100 feet, you should not be short of breath. Okay, um, walking 100 feet, you should not, your heart rate should not just start to beat real fast and cause you other problems. So if heart attack is related to CHF, then you're going to have more problems. You're going to have shortness of breath while at rest, upon exertion, laying flat. And if you notice when you go to the hospital sometimes, it's because before I was a nurse and going to the hospital with my parents or whoever, I can remember the doctor asking my parents, how many pillows do you use at night? And I'm like, why is he asking how many pillows my parents use at night? It's kind of a crazy question, but I know now because it's hard for a person with CHF to lay flat. Um, so that's why he was always asking that. So how is we have other diseases that may contribute to CHF, and those other diseases may be high blood pressure, diabetes. Also, if you're having problems with the valves in your heart, and also some medications. So be careful of taking a lot of over-the-counter NSAIDs, medications, steroid, non-steroid medications. These can contribute also to CHF. So just be mindful of the comorbidities that you have and the medications that you have. Also, some blood pressure medications can cause CHF. So the risk factors, like I just went over, just be conscious of also of high cholesterol and smoking. So everything is smoking. Think about it. Cancer, you can't smoke. So just don't smoke at all. So the test that the doctor will probably order if he suspects that you are in CHF is EKG. That's going to get EKG, or you might know ECG. That's going to get the rhythms of your heart rhythm and rate. Chest X-ray. That's going to check for how much fluid may or may not be in your lungs. And it's going to also check the size of your heart. Then he's going to get a complete blood workup. So you're going to get it's called a CMP, and that's a metabolic panel, and which includes the CBC, which includes your glucose, your BUN, creatinine. And once again, we got to remember those kidneys. The BUN and creatinine, if that's a little elevated, we know there's some problems going on. And we need the blood pressure to be okay so that the heart will be okay, right? Also, what they look for too is called a BNP. And this is helpful to rule out CHF and also to actually determine what is the cause of your heart problems. So now we have treatment. So you have just basically treatments that you can control. Those are modified ones. Like I said, do not smoke, stop smoking. We want to exercise, and we want to control our blood pressure, take our pills, lower the cholesterol. And please, if you're diabetic, you have to maintain a stable glucose. So that means visiting your doctor, seeing your doctor, doing what you are supposed to do for your blood pressure and your diabetes. So that's diet control. Okay, so that may be something the doctor orders first, if it depends on your degree of CHF. So then next we have medications. So medications. One medication is going to be Lasix, and that's a diuretic, and that's going to pull the fluid from your ankles and your knees, which causes CHF, which causes the lungs to build. Or we may get, he may order Bumex. You don't see a lot of Bumex, but you mainly see a lot of Lasix in the hospital. You see a lot of Lasix. And from what I remember, a lot of times when the patient is in full CHF, Bumex is used a lot, also. So then you have, I call it HCTZ, and it's hydrochloride, and that's HCTZ. That's also going to pull some of the, that's going to pull the fluid off of your ankles and legs, which can lead to your lungs being filled up. Then you have your blood pressure pills. You have your ACE inhibitors, which is ACE inhibitors, which that increases the amount that your heart has to compensate for this disease. And then you have your beta blockers that controls your heart rate, that controls the output, okay, of your heart. And then you have your DIG, your digoxin, that also controls the heart rate, and it increases the cardiac output. And that in turn helps control the system, helps control the disease. So I hope you have enjoyed my YouTube video, and if you have any questions, I guess you can email me at my school address. And I hope I didn't say too much. Thank you, and have a good day.